How is this orientation gyrulation done? Seating the patient. The patient is seated in a comfortable position with his head upright and supported by headrest, marking the points for armadillar position. A point is marked 13 mm on a line running from the outer canthus to the superior border of tragus. A notch index about 2 mm deep is made in the first molar region. This helps in positioning of the face bow. The maxillary and mandibular occlusal rims are inserted in the patient's mouth. Preparation of bite fork. Alu wax is softened and shaped to the form of a horseshoe, and the bite fork is embedded into the soft wax. The thickness of the bite fork and the wax should not be more than 6 mm. The bite fork with wax is inserted into the patient's mouth. The midline of the bite fork should coincide with the midline of the maxillary occlusal rim, and the stem of the bite fork should be parallel to the sagittal plane, and please ensure that the stem is always on the left side of the patient. Placing the frame of face bow. With the bite fork in position, the face bow is guided onto the stem of the bite fork. The thumb screws are tightened to maintain the spatial relationship between the face bow and bite fork. The face bow assembly along with bite fork is gently removed from the mouth and positioned in the articulator. Situations where face bow is not required is when monoplane teeth is going to be used for balanced occlusion, when there is no intent to change the vertical dimension of occlusion, or when articulator does not accept face bow transfer. To conclude, failure to use face bow can lead to errors in occlusion. Hinge axis is a component of every masticatory system of the mandible and cannot be disregarded, and this hinge axis should be accurately captured and transferred to the articulator. So it becomes a fine representative of the patient, and biologically acceptable restoration is possible with the use of face bow. Whatever may be the controversies recent by in use of face bow, it should form an integral part of prosthodontic treatment.